Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right, and it is crucial to personal, community, and socio-economic development. Mental health is more than the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to the next, with varying degrees of difficulty and distress and potentially very different social and clinical outcomes. Mental health conditions include mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. People with mental health conditions are more likely to experience lower levels of mental well-being, but this is not always or necessarily the case. Throughout our lives, multiple individual, social, and structural determinants may combine to protect or undermine our mental health and shift our position on the mental health continuum. Individual psychological and biological factors such as emotional skills, substance use, and genetics can make people more vulnerable to mental health problems. Exposure to unfavorable social, economic, geopolitical, and environmental circumstances, including poverty, violence, inequality, and environmental deprivation, also increases people's risk of experiencing mental health conditions. Risks can manifest themselves at all stages of life, but those that occur during developmentally sensitive periods, especially early childhood, are particularly detrimental. For example, harsh parenting and physical punishment is known to undermine child health, and bullying is a leading risk factor for mental health conditions. Protective factors similarly occur throughout our lives and serve to strengthen resilience. They include our individual social and emotional skills and attributes, as well as positive social interactions, quality education, decent work, safe neighborhoods, and community cohesion, among others. Mental health risks and protective factors can be found in society at different scales. Local threats heighten risk for individuals, families, and communities. In the context of national efforts to strengthen mental health, it is vital to not only protect and promote the mental well-being of all, but also to address the needs of people with mental health conditions. This should be done through community-based mental health care, which is more accessible and acceptable than institutional care, helps prevent human rights violations, and delivers better recovery outcomes for people with mental health conditions. Community-based mental health care should be provided through a network of interrelated services that comprise mental health services that are integrated in general health care, typically in general hospitals, and through task sharing with non-specialist care providers in primary health care. Community mental health services that may involve community mental health centers and teams, psychosocial rehabilitation, peer support services, and supported living services, and services that deliver mental health care in social services and non-health settings, such as child protection, school health services, and prisons. The vast care gap for common mental health conditions such as depression and anxiety means countries must also find innovative ways to diversify and scale up care for these conditions, for example through non-specialist psychological counseling or digital self-help. Promotion and prevention interventions work by identifying the individual, social, and structural determinants of mental health, and then intervening to reduce risks, build resilience, and establish supportive environments for mental health. Interventions can be designed for individuals, specific groups, or whole populations. Reshaping the determinants of mental health often requires action beyond the health sector, and so promotion and prevention programs should involve the education, labor, justice, transport, environment, housing, and welfare sectors. The health sector can contribute significantly by embedding promotion and prevention efforts within health services, and by advocating, initiating, and, where appropriate, facilitating multi-sectoral collaboration and coordination.